Tonight, supercharging our Pfizer rollout. Millions more Australians now eligible for the vaccine. The Premier dangles a freedom carrot for Sydney-siders, despite a new horror peak in cases. Delta marches west, lockdown extended across all of regional New South Wales. Passing babies and children towards the barbed wire fence. Tonight, the desperate fight to flee Afghanistan. Plus, the Panthers ready to unleash their new star signing in tomorrow's high-stakes clash with the Rabbitohs.
This is 9 News with Peter Overton.
Good evening. We are charging towards our state's vaccination target, a record 132,000 doses delivered in a single day, more than 5.5 million all up. And the rollout is expanding. 16 to 39-year-olds can apply for Pfizer from August 30. But among all the developments today, a sobering one. Another 681 cases of COVID in the community.
In mid-October, Delta Goodrum was due to perform at Kudos Bank Arena. Today, another Delta on the minds of thousands as they queued outside the stadium for a jab.
I just want us to open up a bit.
I mean, we need everyone to come in and get it done.
It was a really long line, but it was worth it, I think.
The chief nurse in charge of the rollout has turned chief promoter, selling the vaccination as a ticket to a new life.
You know, when I was there yesterday, I was thinking the last time I was there was for a concert, and wouldn't it be nice for life to return to normal? So, you know, go there.
Hubs at Macquarie Fields and Warwick Farm overflowing. We've seen lines before, but now it's on an industrial scale.
Oh my God, it's like chaotic. It's giving me anxiety.
The ADF running the show on the outside has unprecedented numbers answered the call for arms.
I booked for 12 and I came like 1 hour early, so it's looked like I'll be here like until evening, maybe by 5 o'clock, 6 o'clock.
I didn't want to actually get it, but I said to myself, you know what, we're all going to get it. It's going to, now or later, we're going to have to get it.
In the last 24 hours, the state notched an incredible 132,000 jabs.
In New South Wales, our vaccination rates are almost equal to some of the fastest vaccination rates around the world.
New South Wales is easily closing in on 6 million jabs at the end of the month.
I know these are challenging times, but I also can see the light at the end of the tunnel.
But one infectious disease expert sees that as wishful thinking.
We're in a steam train that is heading towards a cliff, not heading towards a station.
The numbers back him up. A month ago, the daily case figure was 79. And like that runaway train, they have rolled on, today hitting 681, with one new death.
That's a catastrophe from a health point of view. This is when our health system is now straining, really straining.
The virus is running white hot in Maryland's Guildford, Auburn, Granville, Lidcombe, Greenacre and Blacktown. Record numbers, but no announcement about tightening restrictions. Instead, the Premier is still talking about easing some early next month as a reward for good behaviour. At the same time, the number of people going rogue isn't easing. At Bondi and Coogee, cars are pulled over for spot checks. In Liverpool, people on the streets being fined for not wearing a mask. And nearly 400 have been booked for being out and about without a reasonable excuse.
It's a man who travelled from Bondi to southwest Sydney. The fourth time that police have spoken to this man, and of course his time's up.
From the end of the month, 16 to 39-year-olds will be able to get the Pfizer jab.
1 in 2 eligible Australians have now had their first dose.
By mid-November, with 80% of us fully vaccinated, the door will open to a new life, just not the old one.
Everybody's going to have to learn to live with Delta. Admittedly, in New South Wales, we're learning that earlier than others.
In Kudos Arena tonight, the show goes on. Thousands trying to future-proof themselves.
Just on its own next week, they could do 120,000 doses in that one spot, and we want every single one of those filled.
Mark Burrows, 9 News.
Mark's with me in the studio. The Premier isn't saying what restrictions could be eased by the end of the month.
Well, Peter, she says the government is currently working on what life could look like after 6 million jabs. She says she will announce a plan next week to give the community what she calls a flavour of what freedoms could be on offer. Interestingly, so far, Dr Kerry Chant has shown little enthusiasm for easing up on any restrictions with cases this high. Pete.
Mark, thank you. A primary school in Marrickville is the latest to shut after a student tested positive to COVID. Ferncourt Public on Premier Street will undergo a deep clean tomorrow, while the Hills Public at Northmead will close after a student there also contracted the virus. All staff and students who have been on site are required to get tested and isolate until they receive further advice. Police and New South Wales Health descended on this Kempsey apartment block today in a bid to stop COVID surging through the 12 units. It was too late for 5 apartments where 9 cases have already been identified. Residents were tested in their own backyard, forced into isolation for 14 days. Liz Daniels is with me in the studio. Liz, a horror number of new cases. Where are they?
Well, Pete, more than half of today's new infections were found in just 3 local government areas. 113 cases overnight in Blacktown, 117 in Canterbury Bankstown and a whopping 141 in Cumberland. Penrith was the next highest at 69, while Campbelltown, Parramatta, Fairfield and Liverpool are in their 20s and 30s. Bayside saw 17, Georges River and Strathfield 6 each, and Burwood just 1 new infection. This steep jump over the last 2 days brings our total cases to just shy of 10,000. Our second wave tracking well above Victoria's. Their disaster peaked with 687 new cases in one day. It looks as though we will certainly surpass that marker, Pete.
OK, Liz, thank you. It was supposed to end this weekend, but the regional lockdown has been extended until August 28, in line with Greater Sydney. 21 new cases were recorded in Dubbo and 4 in Mudgee, bringing the total number of cases in Western New South Wales to 167.
What we want is 100% of the community to be abiding by the public health orders, and that's not 95%, not 98%. We want 100% of the community to do that.
Concerns are growing as the virus continues to spread throughout the regions, with new cases in Bathurst, Burke, Gilgandra, Brewarrina, Goulburn, South Kempsey and a further 2 in Queanbeyan. Private hospitals across Greater Sydney will stop non-urgent surgeries from next week so their staff can support the public system in fighting COVID-19. But it's little comfort for patients with other medical conditions who've been waiting months for treatment.
Jasmine Giuliano was supposed to have had her inflamed gallbladder taken out in February, but with non-urgent surgery now cancelled at Sutherland Hospital, she's been left in limbo.
It makes me frustrated, you know, mentally it's a downer. And when you're in pain, you're like, how long can I keep going with this pain and nausea because of the symptoms that I have?
From Monday, private hospitals will also postpone non-urgent elective surgeries, their staff being redirected into the public system to help with vaccinations and to manage COVID-19.
New South Wales Health felt that they needed that workforce and potentially the beds and space in these private hospitals. So a pause has been placed on much elective surgery across Sydney and in some areas of regional New South Wales there's been some pauses, although there's been some changes to that today.
6-year-old Antonio Tom needs urgent adenoid surgery. His procedure was cancelled in the public system, so his parents switched to private.
I'm worried which further delay his treatment, and he will be getting asthma, and which is going to affect if he catch COVID, I'm really worried.
There's growing concern for the long-term health outcomes for patients whose surgeries and treatments are being delayed. There are still some patients waiting for surgeries which were cancelled during last year's pandemic some 18 months ago. These latest cancellations have many questioning how the system will ever catch up. Patients impacted by these new cancellations are urged to seek medical help if they feel they need to be changed to a more urgent category. Laura Tunstall, 9 News.
Victorians got a COVID shock today as the number of new cases jumped to 57. However, Premier Daniel Andrews stressed that 44 of those were in isolation during their infectious period. More than 50,000 people emerged from lockdown for testing. Today marked Melbourne's 200th day of lockdown since the pandemic began.